24th meeting of the Human Service Committee will now come to order. Madam Clerk, could you please call roll?
Ms. Andrews? Dr. Carbone is excused. Chairman Colby?
Here.
Mr. Delahanty? Here. Mrs. Draw? Mr. Gamina is excused. Ms. Cayley? Mr. Lightfoot is excused. Dr. Quattro?
Is there anyone signed up for public forum?
There's not.
Is there anyone present at this time that would like to address this committee? Seeing none, the next item on your agenda is approval of the minutes. You have before you the February 24th minutes before you. They stand approved unless the clerk is notified of any changes by the end of the day. We'll do the food of the week. Well, today? Okay. Today? I know. Flour. Flour. There's many types of flour and different flours for different uses. But the wheat that's grown in Western New York is a soft wheat, soft white, soft red. And what do you think that's used for mostly? Okay. No, cakes. Guess Western New York, there's only one flour mill. Why do you think New York, Rochester's called the Flour City? There's only one flour mill left in Monroe County, and that's out in Churchville. No, it's not Wheeling, it's Riga. Yes. President Dare. This is daring doing wheat with him.
Did have the microphones on? Something about Wheatland? Do you? Oh, it was. Oh, I thought it was Cindy. Oh, well, does anybody know why Wheatland's named Wheatland?
Because it used to be the breadbasket of the world.
Because it won the World's Fair for the best wheat in London back in 1830-ish something, and that's why. Before that, it was called Inverness, New York. Inverness, New York. Yeah. So there you go. And by the way, all of the flour, most of the flour that is made over in Churchville is purchased by a company called the Charles Freihofer Baking Company in Albany.
Not quite all. A lot of it. They have 4 mills. West Star of the West used to be called Agway, and before that was called GFL, and before that was owned by a private owner. But they have a contract with, guess who else? If you buy Dunkin' Donuts, you're getting your flour, they're getting their flour from Western New York. So that's why we have Dunkin' Donuts here today.
Should I declare my interest at this point?
Yes. So, if you're good, there are. There's only 6, so only 6 of you get them. Yeah, we could have an auction on them. All right. The next item on the agenda is new business. Madam Clerk, could you please?
Referral 15-0104.
Moved by Legislator Quattro, seconded by Legislator Draw. Is there any questions? Legislator Caitlin.
Thank you very much, Mr. Chairman. I really did enjoy that. Through you to the administration, I believe this is the same program, or you'll tell me if it is, the same program that was for emergency preparedness training of physicians. Am I correct? Through you.
Through the chair, the MRC, the Medical Reserve Corps, it includes physicians, but it also includes other individuals as well, who potentially can volunteer at the time of need, during some event.
All right, thank you. But at other times that we've accepted fund, are you eating a donut? Show. You're eating. Point of order. They're not healthy.
So?
I don't care if they're Western wheat or not. This is, hey.
What's your point of order?
My point is, are you allowed to eat in the chambers? I know that you're the chairman, but I'd like a ruling on
Chairman, I
this.
can make the rule I want, can't I?
No, you just asked me if you could. No, you can't.
I didn't ask you, I said, I'm chairman.
You said, can I? And I said, no. All right.
Back on task, please.
You're done chewing, okay. Through you to the, through the chair to the administration. If, I believe that this is the first time I've seen a grant come through that said the funds will be used for personal preparedness supplies. This is just a little bit different than what we've heard before. Can you explain that a little bit, please?
Through the chair, this will include, certain things, including the GO kits, which are preparedness kits, that are offered to volunteers after they've gone through a certain level of training. It sort of, provides, if you will, like maybe an incentive for them to enroll, participate, and then also maintain their readiness in the community.
Okay, thank you. And then just one last one. Can you estimate how many volunteers and physicians and health professionals have gone through this training program?
Through the chair, for Monroe County, our most recent estimate is roughly around 359, volunteers, for the county, and that's up from, 320 that was in the prior year, which was 2012, compared to 2013.
Thank you.
Is there any other questions? All those in favor say aye. Aye. Opposed? Motion carries. Next item.
Referral 15-0105.
Moved by legislator Draw, second by legislator Delahanty. Any questions? Seeing none, all those in favor say aye. Aye. Opposed? Motion carries. Next item.
Referral 15-0106.
Moved by legislator Delahanty, second by legislator Quattro. Any questions? Legislator Cayley.
Much. I just have a question or two on the capacity of this program with the grant money that comes in. Can you say that with the acceptance of the grant that it increases the figures in the number of children that are serviced with special needs?
Through the chairman.
Through the chair, this represents maybe an increase of about, less than $5,000, from the last year. And roughly we provide, service to about 400 individuals, during the period of the year. It's hard maybe to sort of estimate, whether that represents, increased capacity, simply because the individual needs of, different clients and different families, that those vary from year to year.
Thank you. And then through the chair, are we capable of responding to every family that applies for special help?
I guess, through the chair, the way I would respond to that is like, for those that are eligible and where an individualized maybe plan, has been determined in partnership, with not only our staff, but also with the providers and the families, we meet, I guess, maybe those needs. Now, in some cases, we have some limitations in terms of the timeliness in terms of when that rolls out, for various reasons. Whether that means we're meeting every single person's, maybe need who, one, may not be eligible, or maybe two, that may not be maybe appropriate based upon, certain criteria that we have to go by. That's hard to say.
All right, thank you.
Is there any other questions? Seeing none, all those approved, say aye. Opposed? Motion carried. Next item.
Referral 15-0107.
Moved by legislator Quattro, second by legislator Draw. Any questions? Legislator Andrews.
Thank you, Mr. Chair. Through you, can I just get a brief understanding of what this is, this delisting process for the embayment area of concern program, please?
Through the chair, this is maybe like the third time we've received, I guess maybe funding, on this project. This has been an ongoing project, really to look at, how we can sort of come about, and just maybe over time, the process of delisting, some of the embayment areas, maybe in Rochester. and some of that now at this point, which is in, if you will, stage 2, that a lot of that effort will reflect, coming up with semi-annual reports that have to be submitted, I guess, to the federal government, but as well as actually holding, if you will, public meetings, comprising a newsletter, and otherwise, providing education and information, I guess, maybe to Monroe County residents, particularly maybe those that are impacted or potentially impacted.
Thank you. Through the chair, so do you envision holding public hearings about this during this year?
For this, through the chair, through this project, it's a 2-year grant, and so during that time period, we do have plans to have that rolled out. I can't give you a specific time in terms of whether that's going to be in the first or the second year, but there will be, if you will, public forums. I don't know if I would necessarily characterize them as hearings.
Okay, thank you. And are there certain areas that you've already identified that are more likely than others, through the chair, to be delisted?
Through the chair, not at this time. Part of what we have to do is actually have a lot of our more specific detail maybe approved by our funder.
Okay, thank you.
Any other questions? Seeing none, all those in favor say aye.
Aye.
Opposed? Motion carried. Next item.
Referral 15-0108.
Moved by legislator Draw, second by legislator Dale Handy. Legislator, are they both hands are up? Oh,
Oh, mine is.
I know. Legislator Andrews.
Thank you, Mr. Chair. Through you, I know we've accepted certainly grant money for the Nurse Family Partnership Program in the past, but it appears different that it references the National Service Office. Could you explain if that's a substantive change or how that would affect the program, or in fact, perhaps it's always gone this way and I just noticed it this time?
Through the chair, with this particular contract, this goes to the national primarily because since it is a national program, they hold the rights to it. They also deliver, if you will, maybe the initial training to the nurses that participate in the program. And so that training is only offered, I guess, maybe through them. So we use this contract maybe to have some of our nurses who need to go through that training participate in that. Yet, that's specifically for those who need that initial training. And that may not necessarily be the case for other nurses who've gone through that training already who still are in the program.
Thank you. Through the chair, is it new that we'll be going through the National Service Office, or is this how we've been doing it all along?
No, this is not new, but it is the newer nurses who come into the program who have not had that training who go through it.
Got it. Thank you very much.
Any other questions? Seeing none, all those in favor say aye. Aye. Opposed? Motion carried. Next item.
Referral 15-0109.
Moved by legislator Delahanty, second by legislator Quacho. Legislator Legislator Andrews.
Thank you, Mr. Chair. Through you, in reading this, it sounds like the intent is to just kind of have a couple of people on contract to bridge the time period until we can hire regular staff members to perform these services. If that's accurate, my question then is, why would we need this contract to be for up to 3 years? Do we think it would be possible to hire people on a permanent basis in less time than 3 years, or why is that the time frame?
Through the chair, I mean, the reason why we have this contract for 3 years is maybe just to provide us with that added capacity so that not only can we get caught up in some of our backlog, but we can also continue to do the work, for the increasing cases that have occurred. And given that we only have 2 pathologists, currently right now, out of maybe the 4 positions that we have, of which one of those is on medical leave right now, it really does, challenge our medical examiner's office overall. And it's not like you can say in the community, because we are short-staffed, have people stop dying in the county, or for that matter, the other counties that we provide service to. So that's one of the reasons for putting this in there that will allow us to meet those needs.
Sure, I understand that. Through the chair, is there any reason why any of these people couldn't have been hired as in the full-time positions instead of being contracted?
Through the chair, I mean, the issue with that is these individuals, they currently work, I guess maybe in other jurisdictions, specifically New York City, so they already have full-time jobs, so really they're providing the service in part maybe to help us out and to help out Dr. Dignan, the medical examiner, who they know, respect, and they realize that we're in something of a bind.
Thank you. And then through the chair, what's the process then that we're using to try to fill the full-time positions?
Through the chair, we're continuing to solicit, and take every possible, opportunity that we can to recruit. Our chief medical examiner, she recently went to, a national conference and did some recruiting while she was down there.
Thank you. Then do you have a timeline that you anticipate we'd be able to fill the full-time vacancies?
Through the chair, I can't speculate because it's been very difficult in the past, to recruit for medical examiner, and that's not just here in Monroe County, that's nationwide.
Thank you. And last question through the chair, then there's funding in the current year's budget to fill these positions if we find people who will take them and who are qualified?
Through the chair, that is correct.
Thank you.
Any other questions? Seeing none, all those in favor say aye. Opposed? Motion carried. Are there any unfinished business to become before this committee? Legislator Cayley. Legislator Andrews.
Mr. Chair.
You haven't been here, that's why.
Thank you, Mr. President.
You're right. I haven't been here. Just a question. Last year in June, we had a referral regarding the appointment of the County Commissioner of Public Health, Dr. Kennedy's permanent appointment.
Yes.
And it was tabled. And I can't quite recall the entire rationale of why it was tabled, but I wondered if I could ask for a status update in terms of if that referral will be lifted from the table at some point in time, when we can expect that, or if the issues have been taken care of so that we can move forward with his confirmation.
Bill, do you have an answer for us?
Through the chair, be more than happy to provide you an update in writing.
Thank you very much. I appreciate that. And I have one other question, if you don't mind.
Go ahead.
Thank you. While we're here this evening, just if Dr. Kennedy, perhaps through you, Mr. Chair, could give an update just on the whooping cough cases that have been found in Monroe County?
Through the chair, we can provide, a written, explanation for some of the recent trends. But what I can tell you is that we've noticed that, whooping cough, our baseline has changed just over the last, perhaps maybe 5 years, and that's not, necessarily unique for Monroe County, as what you've seen throughout New York State and the rest of the country. There's multiple reasons that have been put forth in terms of, why the numbers, have increased. Some of that maybe reflects, if you will, waning immunity, from some of the prior vaccinations. And as such, different things have been recommended, including appropriate boosters at certain age groups, and some of that guidance has changed. Some of that also maybe reflects, as folks are perhaps maybe well aware, individuals, who may decide for whatever reasons maybe not to get the vaccinations, and then they may end up getting ill, with the disease, and therefore put others at risk, whether that's in close quarters, because of camp or something like that, and even those individuals in those specific situations who might be vaccinated are at a higher risk just because of the close proximity and the duration of time that they may be around such an individual.
Thank you. I would take you up on your offer, too, if you could supply us some numbers in writing about the trends. That would be very helpful.
Through the chair, we will do that.
Thank you very much.
And there's no other matters to come before this committee. The March 24th committee meeting of the Human Service Committee stands adjourned. The next meeting of the Human Service Committee is scheduled for April 28th at 5:30. I think I read